All right, good afternoon, everyone, and welcome to our Collegiate Recovery webinar on providing telehealth recovery support amid the COVID-19 pandemic. My name is Tim Rabel with the Association of Recovery and Higher Education, ARHE. I'll be the host for today. We're joined by Jody Sneed and TJ Howard from MAP Health Management. You can read more about the work that MAP does on our webinar description or by visiting thisismap.com. These webinars are hosted by the Association of Recovery and Higher Ed in order to support the growth and development of the collegiate recovery field. Just a few quick reminders and logistics items before we turn things over to the folks from MAP. Today's webinar will be recorded and uploaded to YouTube and the ARHE website. You'll be able to go back and access all the information at that time. If you have any questions for our team or presenters, you can enter them into the Q&A box down below. There'll be some time at the end for question and answer. We'll get to as many of those as we can. If you're having any trouble during the webinar, feel free to message me directly using the chat box. You can switch it from everyone to just my name. And then any supplemental materials from the presenters, such as slides or handouts, they'll be emailed out to all webinar registrants along with that recording. We're always looking for ways to improve and topics to cover. So any feedback from our attendees, you can feel free to reach out at any time and let us know about the experience today. And now we're going to turn things over to our presenters. So first we have Jody Sneed. Jody has 8 years working directly with the substance use disorder population. Currently, she's a peer recovery support specialist supervisor at MAP Health Management and has worked in varying levels of care as a tech, admissions, and addiction counselor. She utilizes her 9 years of personal sobriety through multiple pathways as a way to help staff and clients achieve their recovery capital goals. And then we have TJ Howard. TJ has 10 years of experience working directly in SUD treatment centers. Currently, he's the Vice President of Enrollment Operations at MAP Health Management. Prior to joining MAP, TJ held positions in treatment as a tech, counselor, case manager, admissions specialist, director of admissions, and multiple corporate director roles. He has performed interventions, safe client transports, and has an extended history being a resource on addiction and helping those in need. TJ holds a bachelor's degree in criminal justice, criminalistics certificate, and did post-grad work in biology at the University of North Texas. TJ is a licensed chemical dependency counselor in Texas, a certified addiction professional in Florida, and an internationally certified alcohol and drug counselor. I'm going to turn things over to TJ, who will then talk a little bit about MAP, and then hand things over to Jody. So TJ, it's all you.
All right. Thank you, Tim. Thank you so much for inviting us. We're really excited to be on with you guys and excited to talk about telehealth with kind of the circumstances that we're at and with the world today. And so we're really excited to be here. So first of all, I wanted to thank you for having us. So our focus today is going to be on what telehealth is and some tips and some different ways to administer some telehealth. And I'll start off and talk a little bit about what MAP does and why we're kind of positioned to talk to you today about telehealth. It's something that we've been doing for quite a while. So if we'll go to the next slide, I'll talk a little bit about kind of the history of MAP and who we are and what we do. And I know everybody can read the slides, so I'm not going to read the slides per se, but I think the important thing to know and understand is we are a company that has been doing telehealth for the last 9 years. And so this is not something that we just recently jumped into due to circumstances. We have been utilizing telehealth to perform our service for the last 9 years. And over the course of the last 9 years, we've supported 15,000 patients, have had over 300,000 peer-led engagements, and we have had the opportunity to learn from many mistakes and be able to kind of refine our practice. And so that's where Jody's going to come from, is a kind of a place and spirit of helping everybody to understand how to engage with patients and maybe some pro tips and some things to think about while you're in this position of administering telehealth with patients. What we do is we administer peer services to those people with SUD, right? And so those that struggle from substance use disorder, we have a peer service company where we provide peer services to many patients. And so that to do that, we provide those services all across the nation. And, our main platform is telehealth. And kind of in addition to telehealth, we also have telephonic communication. but both are heavily incorporated into what we do and how we provide our services. And so that's a little bit about our history, and we'll kind of move on to the next slide, where we talk a little bit about who our peer recovery support folks are and what they do. And, you know, we are all certified as peer recovery support specialists by NADAC. And you see the specific outlined guidelines to get that certification. The things that I'm the most proud of on that list are the fact that all of the direct care team members that work for us are all full-time employees, right? And so we don't have, you know, a 10-hour-a-week part-time employee supporting patients. We have all of the patients being supported by full-time employees with full-time benefits and all of the you know, things that come with being a full-time employee. And so I think that's really, really important. And I also think it's really important to highlight that obviously all of our peer recovery support specialists are in their own personal pathway of recovery. And there's a minimum of 3 years of requirement to be a certified PRSS. We did our average across all of our folks about a month ago, and it was the average at that time was 9 years of continued sobriety and continued recovery. And so I always highlight that and let folks know that when we support people with substance use disorder, we're not, you know, doing it from a green place. We are seasoned kind of veterans that have been in recovery on our own for minimum of 3 years, but an average of 9 years. So kind of moving on. One of the things that is most important, and quite possibly the most important thing about providing services via telehealth, telephonically, or even in person is engagement. And the thing about engagement is you cannot provide support, either clinical or peer support, if you can't engage. And so I think that's probably the most important thing, you know, to take away from today is the key is engagement. If they will not pick up the phone when you call, if they will not come to the office when you have a scheduled visit, if they will not attend a Zoom meeting that you have scheduled, you can't support them. You can't offer them your clinical advice, and you can't do anything with the patient if you can't engage them. And so one of the things that I know Jody's going to spend a whole lot of time with is engaging, and maybe what are some tips to encourage engagement and make sure that when you call, folks are looking forward to your call, because really that's the place that we've got to live in and be in, is that place of they need to look forward to your call, and they need to look forward to engaging with you. They need to look forward to coming to see you at the office. And so those are the types of relationships that we're really, really focused on. And I'm really excited to listen to what Jody's going to talk about here in just a little bit. We have found that over the course of 12 months, we can actually engage with the client, and that 50% is a little bit of an old number. We actually engage at a 62% rate over the course of a 12-month sample size. And what that means is that out of the thousands of people that are enrolled in our program, any given month, we engage with approximately 62% of those people. And those of you that have worked with SUD folks for a long time know that people with substance use disorder are really, really good at avoiding engagement. Right? They're really, really good at not picking the phone up and having reasons to not meet you at the office, or have reasons, oh, you know what, I had to do this other thing. And so I think that we are really proud of our ability to engage with folks, but that all boils down to building a positive therapeutic alliance with folks. And, you know, it's hugely important. I can't emphasize it enough that engagement is really the key, because without engagement, you don't get to offer the support or the clinical services, and you don't get to see somebody on the other side of it, or you don't get to walk with them through their process or path, because you can't engage them. And so with that, I'm going to hand it off to Jody and let her kind of take you down the rabbit hole of engagement.
Thank you so much, TJ. I'm really, really excited to be here. You know, I think TJ hit it on the head. It's like all about what can we do to make them want to engage, you know? And so one of the things that I really wanted to get into is like not only what is peer recovery support, but then some of the stuff that we've learned along the way in order to help them engage. One of the things that I was most excited about a while back when I started getting into peer support services was the fact that it's amazing how long we've known about how important the continuum of services is, you know, when it comes to substance use disorder. Like through the 70s, people knew that we needed like ongoing support for people coming out of treatment. And then as people start to rebuild their lives. And so what's really exciting about all this is like every single one of us here is part of that mission to provide those services. You know, it takes the brain and body like 5 years to heal, you know, and so anything that we can all contribute to this and just helping people rebuild their lives is an amazing opportunity. With COVID-19, we're finding ourselves getting creative. And so this entire thing of what, you know, TG and I kind of do every single day, it's all of a sudden we're starting to realize like we can get creative through this. Telehealth exists, and it's an amazing opportunity to be successful in this across the board. So thank you all for being here, and thank you all for having us. So what is peer recovery support? Peer recovery support is a proactive means to support a person in recovery. We call those people PIRs for short. The primary goals of peer recovery support are to extend the continuum of care, to assist PIRs in staying active in their recovery, to detect early risk signs, and to guide PIRs to wellness and healthy recovery. You know, and we're really big on the self-directed plans, and we're really big on meeting people where they're at. And then as they're starting to be able to identify those risk factors themselves, helping them create those plans. I heard it beautifully said today is like a big part of my job is just to help you, you know, stay motivated even when you don't want to. And I love that. That's something I get to do. Strength-based approach. Okay, so you may or may not have heard about this, but basically every single person has everything that they already need inside of them to be successful in this life, to be successful in their recovery. I don't care how many wrong decisions you've made, you have the ability to do something amazing with your life. I don't care how deep you've gone, I don't care if you just skim the surface, like you have the ability to recreate your life. And so what we get to do in this partnership is learn about what strengths you're already bringing to the table and then build on those. There's some resources down there, which is all about the strength-based approach. And then, you know, some things that build on we'll talk about later in the slide, like recovery capital. So what are, and this is something actually, Tim, if you could help us out here, I would really love to get some information from you all. What are some advantages to telehealth? A lot of us, what we're doing when we're coming into the game is we already have these ideas about telehealth. Some of them are huge advantages, or some of them are actually barriers. And I know I came to the table with some barriers in believing what telehealth can actually accomplish. So if you guys don't mind in the chat box, you know, just say, you know, what are some advantages you already know when it comes to telehealth? And Tim, if you don't mind just sharing some of those.
Yeah, I think Tom just had a good one, convenient for many of our students. I think some other ones, or let me put the video back on too. But I think from, you know, what staff are sharing right now, I mean, one, it's, you know, they're kind of forced into it with the circumstances of everything. Yeah, I mean, I think the convenience part can't really be overstated enough. I mean, I know for me, you know, personally, just like having the option to talk with, you know, like a therapist the other day, being able to drive out in the car and get on the phone and do a video call and things like that. I think that aspect is really important. It's great to see some of these other comments that are getting thrown into the chat box.
Fantastic. Thank you all so much for sharing those. One of the advantages that I've really been blessed in being able to hear is like some people will talk about, like I've literally talked to somebody on the mountaintop where there's nothing recovery related for miles, you know, I mean, and I'm talking like an hour and a half is the closest meeting. Or, you know, there might be one therapist in the town or something along those lines. And I've been able to support them. So that's really been a fantastic opportunity as well. But then I've also been able to speak to somebody who's in a recovery-rich community. It's everywhere. And they are going from a treatment facility to an IOP to a PHP to an IOP, and then they're inundated with, their therapists and their new therapist, and, all of these different things that are phenomenal things. And I get to be that anchor through it all, and just keep talking to them no matter what, so that no matter what information they're digesting, I can be that one constant with them throughout that entire thing. And so this is really great opportunity that it doesn't matter where you are or what your circumstances are. Telehealth can be that that anchor for you. So with that, I'm going to do the exact same thing. I'm going to open up the chat just to, what are some beliefs that you and your clients may have that are barriers to telehealth success? And Tim, whenever you are able to, just share a few of them if you don't mind.
Yeah, to put on the spot again. Yeah, I think, like I'd go back to what, like my personal experience has been with it, coming up as a student in recovery and, obviously still in recovery now. But there's, something about the lack of the human in the actual physical room, and feeling that you may not be able to adequately communicate or express what is going on, because generally it's discussing a subject matter that's pretty beyond surface level. So it's not just discussing facts back and forth. It's like what's really going on with me or with you, and to not be able to see you can see some body language obviously over video calls, but still, there's different things with like hearing size or posture, different things like that. So that's kind of what comes up for me, what I thought about that I'm sure other students may have related to as far as the barriers.
Yeah, absolutely. And not only are you not alone in that, but I had those exact same beliefs as well. And how much can I really accomplish in a telehealth environment? And so thank you all for sharing. One of the things that okay, so don't tell my tricks, but when I hire people, I ask very specific questions. And it has a lot to do with being able to engage somebody quickly, right? And I was able to ask a question to somebody, and she's like, well, how much can you really accomplish in over the phone? What are some things that you can do that can, really engage somebody quickly, type of thing. And she said, I don't really, I, all my family lives in Puerto Rico, and all of them do. And it's every Wednesday, that's when I get on the phone with all my family and I get to talk to them. And every single week we talk about the most intimate things, the things that I just can't wait to share with them. It's the day of the week that I look forward to the most. And every time I get off the phone, I just feel like a whole new person. And that resonated with me because that's exactly what telehealth is. We're talking about some of the most amazing things, amazing opportunities, and it doesn't matter where it is, and it's all intimate. And it's just a matter of remembering that, if I think that there's only so much that can be accomplished over the phone or in Zoom or things along those lines, that might be actually just an internal belief that I need to kind of move past. But it's also something to recognize that our clients might be experiencing that as well, and so helping them not fall into that trap and really engaging them. I don't care if I have to get an extra cup of coffee to show up and just show my vibrancy every single day. That's exactly what I'm going to do. That there's no barriers here. We can make this happen, and it's just it is what telehealth is an amazing opportunity. So with that, hold on. There we go. All right, so peer recovery support can be effectively provided utilizing telehealth support or video support mechanisms. The use of technology is effective, safe, and convenient, as it allows for access to recovery support wherever they are across the world. Meaningful engagement is key, you know, and meaningful engagement is, I think, what we're all shooting for, right? You know, like there's nothing better than when you get on the phone or get on the Zoom, or if you're, you have those in-house engagements. There's nothing better than when you guys can just feed off of each other and just have those really, really meaningful conversations where you can feel the value, right? But there's also adaptive engagement, and this is actually one I love, you know, because it requires me not to feed off of their energy, you know, to help them want to engage, and to allow me to be flexible with wherever they're at and show them that this is a safe environment and I'm here to connect with you. And so, so that adaptive engagement, it means that I have to have a whole arsenal of things to be able to make somebody want to show up the next time. So here are some pro tips. When it comes to pro tips, well, one of the things that we're kind of lacking here is eye contact, right? With Zoom, we can make this a little bit easier though, because they can see me, I can see them. But there is a thing that I need to be cognizant of. One, where is my camera? And then where is actually the picture of them? Because if I put your picture over here, it no longer looks like I'm giving you eye contact, right? And so I want to make sure that I maintain that illusion of the eye contact, because now it feels like you and I are engaging. We're engaging each other, right? And so that's a really important part of this whole thing. Be aware of delays, okay? It's amazing how many times I've accidentally cut people off. I didn't mean to, but there was a delay. You know, so slow down your speech. Give that extra, you know, few seconds to allow somebody to respond to you. Be okay with that silence for a moment, which can sometimes be pretty difficult, you know, like you have to almost fight the urge and be okay with that silence. Be aware of your distractions. Working at MAP, I have an all-in-one computer. So my email alerts are coming on, my Teams alerts are coming on, but the most important person right now is the person in front of me. And so I want to make sure that all of those distractions are not there. You know, I work from home. My dogs, I do not let them in my office. And there's a reason for it. It's because I don't know when they're going to start barking. But those are the things that I want to be cognizant of, because I really want to respect that person. I want them to know that they are respected, and they have my undivided attention. It's amazing when they can't see you, especially, how everything else is heightened. All the other senses are heightened. So I've even had it where I saw an email alert come up and it showed like a few sentences of it. And somebody, while he was in the middle of talking, was like, "Where'd you go?" I was like, "Nope, you got my attention." And like, but it was amazing how quickly he sensed that I was not 100% present. And I never want anybody to feel that way. Background, warm, inviting, professional. Allow them to have something to focus on other than you two. Especially if they can be intrigued by it. It's really interesting. I never noticed it, but there's that chest in the background. People love that chest, and they love to ask me about it. And it's just a hand-me-down, but people love to talk about it. Presence. Look like you dress to go to the office. You know, everything should be the same, with the exception of the mode of communication. Everything else is the same. Be aware of your microphone likely picks up unintended noises. Okay, so all of those things that it's probably a very good quality microphone. So just be aware of those things. You know, even if my dogs are too close to that door, that microphone will probably pick it up. Know your technology. Know how your sound quality is without headphones, with and without headphones. We actually here at MAP prefer the headphones because of the quality of it. It sounds like we're having a direct conversation. Be aware, if you're utilizing those headphones, the differences between a meeting platform versus maybe the phone. Also, if you've ever, depending on how good your computer quality is as far as sound goes, be aware that it may sound like you're pretty far away. So test all that out. If you are using Zoom, be aware of the error messages should one meeting run into the other. It can give somebody a misleading idea that that meeting is actually not working, that Zoom link is not working, and it's just that you cannot be a host of two meetings at the same time. So you've done all the prep work, you've shown up, you're ready to go, and then the technology fails anyways. That is going to happen. You know, there's a lot of things that we're just not in control of. So just be aware of that and start to think about now, how will you prepare yourself and your clients for this? What are some of the backups that you utilize? Such as like, hey, I have your phone number, I'll give you a call. You know, those types of things. So start to think about those now, because it's just inevitable. Technology will fail you in that exact perfect moment. So building rapport quickly. This is actually my favorite topic to talk about. And the reason is because I'm such a big fan of communication. It's like that one skill set that's probably the most important part of everything I'll ever do in my life. And yet it's something I will never perfect. So I love communication. And, you know, when I worked in treatment, it was a very interesting way of communicating because on the one hand, I want to talk to you everything about recovery, but I also have to make sure you make your bed and show up to group on time and those types of things. So it was a very interesting communication style. Working in IOP and the PHP programs, I love that. I get to talk about it in group, like, and we get to develop new behaviors, and then you get to go practice them once you leave here, and then we'll talk about again tomorrow how you did, right? On the phone, this heightened my ability to communicate. You know, there was a lot of fears that I got to address pretty quickly, which is, you know, again, like rejection. Oh my goodness, if you do not respond a certain way, I have to challenge myself that they're not rejecting me, right? And so I get to challenge them, and I just get to talk to them and build that relationship quicker. All of these things are mechanisms for me to build rapport quickly. So one of the things that you already have a common bond on, likely, is that you are both discovering telehealth together. Use it. So this is going to be fun. Let's talk about telehealth. How did you enroll? Did you find it easy to get into Zoom? Let me tell you about my first encounter with Zoom. Use that. It's a common thing that you guys get to talk about. I love the direct questions. Obviously, there's a lot of reasons to use open-ended questions, but I get to talk to a lot of people that are less interested in engagement, and those are my favorite people to talk to. And so what I'll usually do is like, hey, how's everything going? You know, and then you can hear the apprehension. Well, have you been able to stay sober since the last time we spoke with you? And you hear that pause. That's my favorite sound. And the reason it's my favorite sound is because that's contemplation. And that's when I get to insert myself and remind them that this is a safe place. You know, and I tell them about a little bit about me. My name is Jody. You know, I'm somebody in long-term recovery. You know, let me tell you all the reason, like, yes, I have 9 years sober today, but it took me a long time to get there. And then all of a sudden, you know, no matter where you're at right now, let's talk about it. And let's just know that I'm here to walk alongside you. Open-ended questions. And then don't allow them to use that one-word answer. Keep talking. Tell me about it. You say, okay, what does that mean to you? Fine. What does that mean? Tell me more about it. Ask permission when asking a challenging question, and give them time to agree. You know, I'd really love to ask you a question, you know, about that, but I think it might be challenging. Would that be okay? And because one of the things, because I'm not in a room environment, I'm less able to bring it back right then and there, you know? So when I want to ask them a challenging question, but I don't want them to think it's any other reason other than to help them grow, I want to ask them permission first. Once they get a time to contemplate it and say yes, then I can ask that question. And it's amazing how they all actually, more often than not, they'll actually take time to consider what that answer is. So it's this really great opportunity to build rapport. My sessions are going to be, you know, the more I can keep them goal and action oriented, the more I can utilize that time. It also gives me the ability to provide follow-up for the next session. Summarize the session, including any footwork they agreed to. I love to talk in terms of what their commitment was. Their commitment to their what is it? Their personally developed goal, their commitment to themselves, you know, those types of things that I can help them, you know, follow, not only just outline, but then follow up on the next session. Here's the thing, allow each session, email, voicemail, and text to be an extension of your personality. I never want it to sound just too professional. Like I want them to hear me in all of that. You know, so I'm leaving a voicemail. Hey, this is Jody from MAP. I'm so excited to talk to you. I can't wait to talk to you. Give me a call back as soon as you can. My phone number is da, da, da. You know, when I send a text, hey, it's Jody. And then there's even an exclamation mark because I don't want you to even suspect for a moment that I'm not excited about this. So here are some open-ended questions. I would imagine as you're sitting there and you're probably reading some of those, you have your own favorites. Remember some of your open-ended questions going into it. Find your favorites. And so that this way, it gives them the opportunity to tell you about you, tell you about them and what's happened since the last time you guys have talked. And hopefully gives you something to build on. Recovery capital. This is one of those things that I just am so excited to talk about because recovery capital is somewhere along the lines, we started realizing that it's not enough to just talk about, hey, don't drink and don't use. Like the goal here is to really help somebody measure, you know, like, hey, let's focus on making your life so great that you don't want to drink and use, right? And so all of these different these metrics on what we can start to develop on. Now, here's the thing about COVID-19. COVID-19 actually created a lot of barriers to all of these portions of recovery capital. You know, so the human connection is all of a sudden like, okay, we need to start getting creative. How do we do that? More Zoom invites, you know, finding out different ways of being able to connect with others. One of the things I started recently doing was actually hand making cards because somehow just the imagination of allowing somebody to open that in the mail helped them feel connected. And so in turn, it made me start to feel connected. And so starting to really look into all of these different recovery capital areas and finding unique ways to continue to develop those areas. For more information, please see, you know, the recovery capital scale. William White has a great article on it. There's just a lot of great information on recovery capital. Responding to use events. MAP, we're not a big fan of calling things relapses, especially because it may not in fact be a complete return to all the behaviors associated, but regardless, relapse has a tendency to produce its own shame. And so we talk about use events. What is the key when responding to a use event? So what is key to responding to a use event really has a lot to do with tone, you know, and I'm not here to judge or shame you. You know, I just want to hear about it. I want to help you get back to that wellness. What are questions you might ask in discovering a precipitating event? You know, more often than not for me, it's just like, tell me about it. What happened? You know, it's an inquisitive mind. I want to know more about it. I want to help you get to the other side of it. What are some things to consider when helping your client create that self-directed plan? You know, how far down the rabbit hole have they gone? Do they need a return to treatment? Are they even interested in returning to recovery? Does their recovery plan include actual abstinence, some sort of harm reduction? You know, and I know that, you know, in the collegiate recovery program, you know, there's some things that additional, you know, I guess, consequences, you know, that are associated with those things. But really the whole part of this is just like, how do I help you create that self-directed plan? Where do you want to go from here so I can help you? When you're talking to somebody from another state, city, it's helping them find resources that are actually local, and then helping them, you know, one of the things that I'm a really big fan of is just providing that resource and then asking them to follow up on it. You know, like, okay, so you're going to give them a call. I'll give you a call in a half hour and let's check in and see how that went. You know, so follow up. Does this need a follow-up session? Okay, so you outlined a great plan. I want to give you a call on Friday, and what we'll do is we'll outline a plan for success over the weekend. Those types of things. There's a lot of online resources going on. You know, these are some of the traditional ones going on here, but there's a lot of online resources. So, if you haven't already, and I'm sure you have, start to get familiar with them. In addition to all these things, some of my favorite things is just listening to a YouTube speaker on, you know, whatever fellowship. And I love it too, because I can even Google search specific things, you know, AA speaker step 1, you know, those types of things, like, you know, um, emotional sobriety. Love that topic. I can never get enough of emotional sobriety. So there is many reasons to need to de-escalate a situation. They may already be under the influence. They may be incurring some suicidal ideations, medication reactions, non-compliance of medication, mental health crisis. You may be hearing some sort of mania, psychosis, and paranoia through the phone. And so it's an important thing to consider, you know, like, how will you respond? Because you're not in the same room with them, you know. And so one of the things that I need to first challenge myself on is to not react based on fear. Okay, I've been trained for this. I know this. Okay, the most important thing for me to do right now is to get back to center so that I can put my training into practice. And it's amazing how, if I can do this, I can actually utilize some of these de-escalation techniques to build rapport. How will you help them feel heard? You know, and some, you know, questions just like, you know, I hear you saying this. Is that what actually you're saying? That sounds really challenging. That even sounds lonely. Is that what you're feeling? I might even be able to share something about me, like telling them about when I felt most alone, or that something where that we can start to connect. And then helping them get into action. Well, what's something that we can do together along those lines? Be aware. And this is something that we want to have a known address for people. And the reason is because when I need to do a wellness check, because again, I'm not in the room with them, I need to know what their local area is. Because of that, because I can't just call 911. Right now, if I were to call for 911 for somebody in Texas, I will get, you know, Volusia County Sheriff's Office. Because that's where it'll be routed to. I need to know where they're staying so that I can find the non-emergency police for that area. They will redirect me to the 911 for that local authorities. From there, they have the ability to make that assessment. And so if my spidey senses are going off, I just want somebody to lay eyes on them and make an assessment that I am not equipped to make at that time. With that, some additional resources. The National Suicide Prevention Lifeline, and we also have the Disaster Distress Helpline going on right now. And that's everything from my end.
Perfect. Thank you so much, Jody and TJ, and really all the folks from Matt for that amazing content. Just a reminder, this is all being recorded, so folks can go on and see everything again once that link is live. We're going to move on into maybe about 15-20 minutes of question and answer. So as a reminder, you can use the Q&A box down below, but you know, we have a couple dozen folks on. I think you'll be able to, you know, kind of click the raise hand button, and I can unmute you all if you'd prefer to ask it, you know, through audio as well. And for folks that registered and submitted questions in the registration portal, we have those as well. So we'll jump into those, and then we'll just keep an eye out for anyone who has the hand raised or throws anything into the chat box or the Q&A. So moving on for the first question, what do you see as the top priority right now for individuals who are providing recovery support services virtually?
You want to take that, Jody?
The question being, you know, what is the top priority when I'm providing those services?
Yeah, just what do you see as the top priority right now? So maybe kind of, you know, in the scheme, you know, the grand scheme of everything, like what's kind of the main focus for anyone trying to do similar service offerings for, you know, for their students, presumably, you know, kind of like the number one thing to focus on. And some of that might have been answered in, you know, some of your slides too, but maybe if it had to be boiled down to, you know, one thing.
Yeah, fair enough. And like, if I had to say anything, it would still be helping them develop that sober support network, because they may have just lost everything that was routine for them as far as that sober support network is, and so it's gotten all of a sudden, like, yes, they might be there, but they're all the way over there. Like, I can't just pop over into that person's apartment anymore. And so that connection, there's a lag in that connection. And so helping them getting resourceful, and not just resourceful, but also being like somehow an acceptance of this is a norm, but we've gotten used, I mean, this is a new norm, but it wasn't that long ago that this was completely foreign to you too, that norm that you just now got comfortable with, so we can develop a new one together.
Perfect.
Yeah, and I'll kind of elaborate on that a little bit. I think that it's important to understand that a lot of folks are going through major transitional struggles right now, and some short term and in some cases even longer term transitional struggles. And a lot of us and those that I've helped to provide treatment for are really good at looking like everything's okay and like acting like everything's okay. I think that, but we need to be hypersensitive when we're providing support and therapy for those of us that are clinicians. I think we need to be hypersensitive on that fact and digging a little bit in that, because you'd be hard pressed to find somebody that is not going through some type of transitional struggle right now. And those of us that like to deflect and not, those of us that like to act like everything's okay and be strong and all those types of things, that's typically going on the surface. And we're all just, I think society is greatly struggling right now, and an awareness to that, just bring that awareness into each one of your sessions. And with that, knowing your folks is of paramount importance, and kind of knowing how they act, what they do, and some of the things that are their telltales are important. And it's really difficult when you're providing telehealth support to not get distracted with your phone, with other distractions. And I think it's important to really focus on the person on the other line, especially when we're all kind of struggling with some transitional stuff. And, those of us that are used to getting up and going to class aren't doing so. And those of us that are used to getting up and going into an office aren't doing so. And those that have children, their kids aren't going to school. And so it's important to recognize that those things are playing huge roles in all of our lives. And, be sensitive to that. And if you have back to back sessions scheduled, you need to schedule time on your calendar to unplug. That is one of the things I get tripped up on, because I'll be like, oh, there's an open spot on my calendar, and I'll jump into like six sessions, like back to back. And by like the fourth one, I'm no good to anybody, and I really need to schedule breaks. So I think that is important, to honor yourself, man, like honor yourself, and like, it's okay to schedule a break and stay up on that and stay with that. And you'll be more effective if you'll do that.
Yeah, perfect. Thanks, TJ. So we had a few more questions come in. Also, if anyone does have the hand raised, I don't know if I can't see it, but put it in the chat box in case. I also see some of the conversation going in the chat box. Susie, feel free to chime in if you want me to unmute you and you want to bring that topic up to the folks from MAP as well. So Rachel asks, any suggestions for college clients who have family members that use, specifically alcohol, and the students are pretty much stuck at home trying not to drink?
Sure. I would love to talk about this. Actually, I spoke with this. I don't mind telling everybody I'm in recovery myself and long-term recovery myself. And this was a topic tonight in my home group. And so, when you are in unprecedented times, kind of managing unprecedented things, like I'm used to being at college where I live with my recovery community, and now I'm back at home and my family are heavy drinkers, that's when whatever support or path of recovery you're on, those principles and those disciplines need to be increased multiple, tenfold. And those that practice a 12-step recovery need to be really, really involved as much as they possibly can with meeting other folks in Zoom settings, attending meetings, being of service as much as they possibly can. And so the mini passive recovery typically they don't force you to not be around those things, but when you're around those things, you just need to be practicing all of the disciplines in whatever pathway you're on at a just more at a higher sensitive place. I remember I was in a family program, and a physician friend of mine was getting asked questions, and they were asking, like, what do you do if you have to have a scheduled surgery and you are an opiate addict? What do you do, right? And the doctor's response was, look, there are certain things that are unavoidable in life, and if you have a car accident or you have a major surgery, you may need to be on some of these prescription medications, and you just need to make sure that, if you have the ability to schedule that, ensure that all of your disciplines and all of the things you do for your own personal recovery are hitting on all cylinders. Schedule it in that time and practice honesty and openness with those that are around you. And so I would take that advice and practice into, if I was now living at home and I'm used to living on campus and I'm now living at home with my mom or dad who's heavy drinkers, or family members that are heavy drinkers, I would dive in head first into my recovery.
Great. Thanks, TJ. A couple more questions. This one is asking about if you've seen any positive kind of recent trends or initiatives or developments, over the past few weeks in regards to, telehealth and virtual recovery support services, kind of, amid the pandemic and outbreaks. Any positive, trends, developments, or initiatives?
Jody, I can let you speak to to maybe some detailed specifics about direct interactions with patients, and then I can talk about more broader things that are happening right now, if that'll be all right.
Absolutely, yeah. I think that my favorite thing to see is that it doesn't matter what one entity you come from or things along those lines. People cannot wait to teach what they're discovering about telehealth. So if somebody's been doing it for a really long time, all of a sudden there's nothing wrong with something like this happening and saying, like, hey, let me show you some of our experiences in telehealth and making you successful too. And so, like, that's my favorite thing to see on a broad scale. When it comes to the development of what we're seeing, just internally as far as our cases are reporting, is the lengths people are willing to go to stay on their recovery path. And how honest people are willing to be about how they're not feeling okay, because all of a sudden all of those the safe nets and things like it just feels very weird. And for the most of us, it doesn't matter whether you're in long-term recovery, short-term recovery. It doesn't matter if you're a clinician. It doesn't matter if you are not. It doesn't matter where you are. None of us have experienced anything like this. And so we're really all in this together, and so, like, that's my favorite part of this whole thing. And so I can go to anybody and be like, this is weird, and somebody will be like, yep. And so we're really all are in this together, and like we're feeding off of each other, and hopefully that's trickling all the way down, and in turn it's definitely trickling up. Like, some of us that haven't been doing the back to basics in a while, we're learning how to get back to basics really, really quick.
Sure. Yeah, thank you, Jody. And one thing that we do, at MAP on a regular basis is we're always in conversations with kind of different state and national government agents, and we're also in regular contact with some of the major insurance providers and those things. And so some of the broader scope things that we're seeing right now, and I've been watching the chat box on the side, and y'all have referenced it quite a bit, is a lot of the restrictions on telehealth and the providing of telehealth are being lifted, and some temporarily and others on larger scales and more permanent. And so I think that's one thing that we're seeing right now in kind of the medical field and the behavioral health field, is that some of those restrictions are being lifted on telehealth. And as you guys were referencing on the chat box, the providing behavioral health services across state lines, which is a major struggle right now. And, you know, it is difficult when you have a therapeutic relationship with somebody in Texas, and then everybody goes home because of this pandemic, and now they're back in Arkansas, and now I'm in Texas as a licensed provider in Texas, and I can't provide services to those in Arkansas. And so there's many states that are coming up with creative loopholes is not the right word, but creative ways to allow that, and maybe some temporary, you know, suspensions on the things that don't allow that. And so we're seeing that across the board. And I think that there are going to be different things that we think are temporary that are going to become more permanent. And I think that a lot of businesses and a lot of healthcare providers are figuring out ways to provide services when people are more into socially distancing and such. And so I think that those are things that are happening all across the healthcare field and beyond in business, where, you know, those things that have typically restricted telehealth and such are being lifted. And I think I think on the other side of it, we'll end up seeing some different legislation to remove some of those restrictions.
Yeah, it's great insight, TJ. So this question is kind of about, you know, any finally points of emphasis, understanding that most of the folks are working within higher ed, right? So they're in student affairs, or, you know, at least housed within colleges and universities. And then, you know, they're working with the student population who've kind of just all been, you know, uprooted from their communities and maybe now living at home if they're not able to stay in the dorm. So any kind of points of emphasis taking those two components into account, you know, that they're working within higher ed, and then that they're working with, you know, students who are at kind of like various, you know, points in their life and in their, you know, recovery journey as well.
Yeah, Joe, do you want to hit on that, or you want me to kind of take it?
Yeah, TJ, go ahead.
Yeah, I think that, you know, I think it's difficult. You know, I think that there are certain things that we're all having to figure out as we go. And I think that, you know, caring for and delivering services to different populations in a different way, or some things that we just kind of have to be malleable and understanding and try to figure out how to like weave through it. And so, you know, I don't know that there's a hard and fast correct answer. I think that it is something that, you know, I mean, at any point, any therapists are really good at winging it and figuring out ways to make it work. And I think that's just what the spirit that we have to take into this, is it all has happened so quick. Right? I don't think we'll be fully prepared to, you know, do any of this stuff. I think that we take the circumstances, do the best we can with the given circumstances with the folks we treat. And I think it'll all kind of come out working really well.
I think it's also like exactly what's happening right now, like in this exact meeting is like, we're all sharing our own little expertise in this whole thing, right? And so like we're feeding off of each other and building on it, because this is an art form. I mean, there's a lot of science to back it all up on why it's so successful. But the more I feed off of you and you feed off of me, and we're just constantly in this state of growth, we're definitely going to come out of this on the other side. And a lot of people are going to look back and be like, wow, telehealth really saved the day in this situation.
Yeah, and you know, in the spirit of that, and what you said kind of made me think about something. One thing that I've been doing, you know, because we're working from home, you know, as well, just so everybody knows, like Jody and I, we are working from home, and we do have an office. The majority of our folks do work from a home office and have done so for a really long time. But one of the things I'm doing with my teams that I manage are, and I would suggest this for those of you who are just now working at home that are used to working in an office, is we schedule specific time. We schedule Zoom meetings to meet together. And even without agenda, we schedule it to try to maintain that human connection as much as we possibly can. And we do so on a regular basis. And it's funny because when we used to have an office that we went to, we would utilize Zoom a whole lot. But we would utilize Zoom and we wouldn't use the video because we saw each other all the time, every day. Now that we're all at home, we all are like, man, get on video. You've got to get on video. And you know, I think that as you are doing so and scheduling things with your office mates and such, those are really important pieces of our day whenever we're in an office, is that 5 minutes that we catch a friend on the hallway. And so as much of that you can continually maintain by being at home, you'll maintain more of a sense of normalcy. And I just thought of something that in Jody's presentation, it reminded me. I do a lot of meetings with people in all areas of the country via Zoom. One thing that is consistent is when you are speaking on Zoom, if you speak at your normal cadence, people experience that on the other end very quick. So you know, I have to like remind myself to slow down my cadence and my dictation, because when I get going, especially when my wheels are turning, I get going too fast, and then nobody can hear anything I'm saying. And so remember that. You know, I get really excited and I elevate and I talk real fast. And when I do that, folks on Zoom can't understand me. And so remind yourself to slow down. I think that's an important piece.
I'm going to remember that one for myself. It's a good one.
Yeah. One final thing, if I could, because I know I didn't mention this in my slides, and I cannot believe that somehow it did not get mentioned, but TJ has talked about it so eloquently so far, is how important self-care is to this whole journey, you know, because it is really about, you know, the more that I practice it myself, the better I can demonstrate it for somebody else.
Yeah, absolutely. So last question here. It's a quick one, kind of two-part from Tom Banner from VCU. Jody, you might be good for this. Well, the first part is, what's the typical number of calls per day, the length of those calls? And then if you notice the tipping point, either amount of time or appointments where you're then not as effective.
Great question.
That really is a great question, and it has a lot to do with the engagement of that day. So, you know, on average, we have a lot of people that are just really doing the check-in, you know, where they've established their recovery capital goals, and now we're just checking and following up on them. So those sessions might last about 15 minutes. But we start to look at about 30 minutes is a really great session for us to really check in. Because again, we're not clinicians. We're here to just to just talk about how everything is going. I can tell you that if we're starting to talk to people for about 40 minutes or more, we've pretty much hit that point where what we're talking about is probably not as productive. We're probably just kind of spinning our wheels. Our objective is to really help people get into action as quickly as possible. So it's kind of talking about it. Let's get to the heart of this whole thing, and then let's come up with a plan, and we'll follow up on it. Whether that's in an hour from now, you know, because again, we're just following up, or next week. But whatever it is, let's create an action plan and then follow up with it.
Perfect. Good note to end on. Unfortunately, that's all the time we have for today. We hope that this session was helpful, and you'll share the information with colleagues, stay connected with ARHE to learn about future webinars, and let us know how we can improve the offerings. To the team from MAP Health Management, thanks for taking the time today. Tom Kimball from Texas Tech, thanks for helping to get this set up. And yeah, thanks again for just, you know, taking time out of your day to present to our attendees about the work you all are doing and how they can improve their offerings for students and others. We appreciate everyone's time. Hope to see some of you on our other weekly webinars throughout April. Thanks so much. Have a great day.